26th at the Chattanooga Convention Center to benefit the work of Siskin Children's Institute and celebrate the children we serve. Tickets at siskin.org.
Okay, if you have school-age children watching television right now, just cover their ears because we're going to talk about going back to school. But it's a good thing. It's going to be here before you know it. And of course, the parents out there want their kids to head into the next school year healthy and ready to learn. So we're very happy this morning to have Trish Goldston on the show. She is a registered nurse with the Hamilton County Health Department, talking about those vaccinations that are also important.
Yes, ma'am.
Good to see you.
Good to see you.
So it is true. I mean, kids don't want to think about in late July, school starting back mid-July, but it's going to be here.
It is here. It is upon us, and it is rapidly approaching.
And you know, you're a mom of two kids that are basically school aged.
Yes.
I can still remember the days of being caught up in the summer fun, hanging out by the pool. The mad rush comes, and then you can't get in.
Correct.
To get the
Correct.
vaccine.
A lot of doctors' offices are on 3-month waits of getting in and getting seen just from backlogs over the past couple of years. So
it was surprising to me, and then you explained it so I can accept the finding. But to hear you say that in Tennessee, the vaccination numbers are down recently.
They are. Over the past 2 years with the pandemic, schools were not as stringent on getting the vaccine records just because everything else was taking higher priority. But it's time to re-up our numbers and make sure that we're getting our kids vaccinated to make sure that not only we're protecting ourselves, but we're protecting our community.
Well, and we can talk about that protection of the community a little bit too, because maybe, not to bring anything into it, but if we look at just vaccines as they've always been, so your MMR.
They're the same classic vaccines. You have your MMR, your chickenpox, also known as varicella. You have your polio, you know, pneumococcal, meningococcal. So all of they're standard vaccines that have been around for years.
And it seems like there are, every so often anyway, stories that will come out nationally of a community where people, especially on the measles, don't get that shot, and then it rapid fire spreads.
Yeah, you can have outbreaks and it becomes kind of like an epidemic in your community. And that's what we want to avoid. We saw COVID and what it did and how it shut down. You don't want to do with that with other things when you can prevent them very easily.
So knowing that people coming to you or their doctor's office, but in your case you, are going to be, they're all going to have different mindsets, right? They've got to have the certain papers to get their kids in school.
Absolutely.
Those do not include flu vaccine or COVID. Those are recommended but not required.
They're recommended but not required. The state of Tennessee does require some vaccinations for school. So for instance, going into kindergarten, your children are required to have their hepatitis A, all of their standard shots, but in addition, hepatitis A, MMR, varicella, DTaP, and polio completed.
Okay.
All of those series should be completed, along with the other standard vaccines that you get at 2, 4, and 6 months.
Okay.
In going into 7th grade, your 11-year-olds, they're going to need their Tdap. That's the only one required by the state of Tennessee. They are eligible for their HPV and their meningococcal vaccines. So that again becomes a personal choice. But with those vaccines being available, I will say most colleges across the United States will require at least 1 dose of the meningococcal vaccine by the age of 16 or later. So you might as well start now and get them fully vaccinated.
Seems like, because I've got one heading off to college, and it seems like are there 2 in that meningococcal?
There are. There's the first meningococcal ACW and Y serogroup, so it covers the 4 strains. The other one is meningococcal B. That vaccine, most colleges that require that one, it's specifically for room and board, because it does affect tight-knit communities that, you know,
we had to
where
deal
you're
with that
living
one.
together.
Okay, so you're rattling off quite a number, and when your kids are no, that's a good thing, because when your kids are little, they're getting
it's overwhelming.
A lot of them.
It can be overwhelming.
So back to your point about timing, for people who like I was always kind of the mom who liked to spread mine out a little bit.
And that's fine.
So timing is important, right?
Timing is very important because you can only receive, like with varicella and MMR, they're considered live vaccines, but they can only be given a certain time span apart. They cannot be given too close together or they won't count and then you have to repeat them.
Okay.
So you want to make sure that you're giving yourself plenty of time to make sure you get those series completed.
Here's something else super cool. I wish I had known this a long time ago. You could, even if you have your own pediatrician who's always administered your shots.
Absolutely.
And then you realize, oh gosh, I got to have that record for the softball team I want to sign them up for.
Correct.
You can get your health
Absolutely.
report from you.
Yes, you can get your shot record from us. You don't even have to come see us. You can go to our website, health.hamiltontn.org, and there is a place on our website where you can actually electronically request your shot records. If you've had all of your shots in Tennessee, all you have to do is request it and we will send you what we have. If you have not had your shots in Tennessee, you can actually upload your shot records from previous states and we can enter them into the Tennessee database for you. Once we have everything entered, we can basically send you back your state form that you can print off at home and take in to your schools.
Okay. So it's the classic vaccines that we've always been talking about. The new ones out there are elective for you. If you will give them a call if you're interested, 209-8050. I don't think an appointment is necessary.
Not for shots. Appointments are not necessary. You can walk in. We recommend, we're open from 8 to 4. We recommend coming in by 8:15 for the morning slots because that's when we first start seeing patients. If it's a straightforward immunization, you can get there by 3 and typically be seen.
Okay.
But if you know you've got paperwork and stuff you have to get done and or you possibly need shots, you're going to want to be there by 2:30.
All right.
So
Thank
you
you
can be
so
seen.
much. And have fun with your own back to school shopping.
Yeah, thanks.
So here's the reality. I'm the only guy named Mark who will come to your home in person and tell you what I'll sell your home for in the open market or give you my guaranteed as-is cash offer. So call Local Mark today.
You only get so many opportunities to follow your dreams. To make your mark in this